Fellowship on Dr. Manmohan Singh, and I pray that he be admitted to the Honorary Fellowship of the Institute.
Honorable Prime Minister of India, Director of AIIMS, Dr. Venugopal, Dean, Dr. Kusum Verma, Registrar Dr. Gupta, esteemed members of the Institute body, faculty, employees, student, parents, friends, ladies and gentlemen. I, as the President of this Premier Institute, would like to also welcome the Honorable Prime Minister of India for coming to this institute for this convocation, and also would like to thank him for accepting this fellowship. India has produced a number of politicians, but a very few statesmen. And we have in our Prime Minister an astute statesman, a very dynamic but a very simple personality. And I personally have a fatherly relationship with the Honorable Prime Minister of India, who guides me day in and day out, and his concern for the country, for the development of this country, and his premiermost concern for the poor masses out there, the rural masses who doesn't have the healthcare, the education, the social implications, and that is his concern. He, having come the hard way in life, and his personally, he had said to me that in his growing days, there wasn't a hospital for about 30 kilometers where he lived, and the problems the people had faced. Sir, thank you very much, sir. And this is one of the very rarest occasions where the institution gets the honor for conferring this fellowship to you, sir. I see in front of me some very raring to go, young, energetic, dynamic doctors and scientists who are going to get their medals, the awards today. And the whole country depends on you. You are the best in the country. And I could go one step further. I could say that you are the best in the world, because wherever I go, I say that Indians are the best doctors, the best scientists in the world. Whether it is America or Europe, the top doctors there in those institutions, the top research scientists are all Indians. And that is why you have a huge future ahead. Sir, AIIMS has completed 50 years, and a lot of water had gone down the bridge. And in those 50 years, AIIMS has been recognized as not only the premiermost institution in the country, but also one of the premiermost in the world. And the government, along with AIIMS, in fact, AIIMS had been advising the government for most of its national programs in the health sector, whether it is blindness or tuberculosis or iodine or any other national programs, and we have been getting not only advice but full cooperation of AIIMS. And today's healthcare scenario. So we all know your concern about the rural masses. And I will never forget in my life, after taking over as a minister, the first words my Prime Minister said to me, he called me aside and said to me, your main goal today is to take care of the rural masses. And since then, we have been working day in and day out, trying to get at the rural masses, improve their healthcare facility. And on one side, today we have globalization, we have modernization, we have modern things like telemedicine, genomics, proteomics, and nanotechnology, all that we have. And in fact, medical or health tourism. On the other side, we have people out there, 73% of the masses living with just about 25% of the healthcare facilities. And then the concept of the National Rural Health Mission, launched by our Honorable Prime Minister on April 12th this year. And this is going to change the entire rural scenario in the country. And down 3 years' time, we are going to see visible impacts of this program. So, the improvement, the growth in AIIMS, in fact, the director of AIIMS had said what all the institute is doing and what it is going to do in the future. We have a lot of mega projects coming out, how we're going to improve, upscale, build more infrastructure in AIIMS and make it, in fact, not one of the premier most, but the premier most institute in the world. And of course, in this mega project, there's going to be one new institute of public health school of public health, which is going to have reputation along with IITs and IIMs, and that is going to be affiliated to AIIMS. And also, sir, the future challenges we have in the country, they're going to be the chronic diseases like diabetes, cardiovascular, mental health disorders, cancers, and of course, our senior citizens. Today, the life expectancy has gone to about 63, 65, and down 15 years, it's going to be 75. We're going to have a lot of elderly senior citizens, and this AIIMS is going to start an institute for aged or institute for geriatrics in the days to come to take care of our elderly. And sir, there are a lot of changes happening in the healthcare scenario in the country, one on the healthcare, then on medical education, on the students, and sir, we are going to have a compulsory rural training. It's going to be 1 or 2 years, sir. He's going to have a compulsory training after he finishes or the candidate finishes the house surgency. And also, we're going to have compulsory continuing medical education to update our more than 600,000 doctors in the country, and every 5 years they have to have minimum 60 hours of continuing medical education. And of course, we are bringing a new act called the Clinical Establishment Act, where all the hospitals in the country and all the diagnostic facilities in the country has to be registered with the district level authority. And we are going to have the Indian public health standards, whereby the hospitals have to follow these standards, whether it is in a village or a town or a city, and in fact, including the diagnostics. So this will pave the way for India to have quality healthcare. And of course, sir, we are going to have a new curriculum in the undergraduate courses, and this new curriculum is going to be more modern curriculum, it's going to be more practical curriculum, it's going to be more social curriculum, and it's going to be more rural curriculum. That is what we want to have in the future. So recently, the UNDP had put up its Human Development Index of this country. And on one side, it said that India is progressing as an economy is growing at a fast pace, and people have more paying capacity, more income, more salary. But on the other side, our indices, our social indices on the health, on the education, it is lacking, and all these years post 58 years after independence. And we are now competing with our neighboring countries. Sir, with your dynamic vision and your leadership, we are all here so to assist you. This institute is there, AIIMS Institute is there to assist you to bring down the infant mortality, to bring down the maternal mortality, and all the other indices, sir. And sir, I would like to state, sir, in front of this convocation, that AIIMS in the future is going to go, if there's any occurring in the country, if there's any disaster of any disease outbreak or any other issues coming up, sir, AIIMS is not going to wait for the government to give its clearance, and AIIMS is going to be there. Before the government machinery is there, AIIMS is going to be there. Students, the faculty, doctors are going to be there before the government is there, whether it is an outbreak of Japanese encephalitis or any disasters or any other diseases, sir. So, with your indulgence, we need, sir, these 6 new AIIMS-like institutions. AIIMS is the only one in the country, in the world, and there can't be another AIIMS. And even though that's a misnomer of 6 new AIIMS-like, everybody wants to compete like AIIMS. And that is the only way, sir, having these institutes, the tertiary care institutes in Bihar, UP, Uttar Pradesh, Orissa, Madhya Pradesh, Rajasthan. That is the only way, sir, to reduce the burden of the patients coming to this institute. This institute for education, for research in healthcare. And sir, by reducing the burden here, more research could happen out in this institute. And of course, Dr. Venugopal had said about the latest things happening like stem cell research and genomics and proteomics and individualized treatment in the healthcare scenario. So our ultimate goal of providing accessible, affordable, acceptable, accountable, quality healthcare with social and ethical background, that is our ultimate goal. And with these words, once again, sir, I would like to thank you on behalf of the AIIMS family for coming here, honoring us and accepting this award, sir. I would like to wish all the awardees today who are going to be awarded and all the graduates who are going to be conferred their degrees, go out to the world, but come back to India. Go get yourself trained out there, but please come back. On this line, sir, I would like to say one very heartening factor. Due to the positive effects of the medical health tourism, now not only patients are coming to India in the hundreds of thousands, but our doctors are coming back. The doctors who have gone abroad 30 years ago are coming back to India in the hundreds, sir. So this is a very positive phenomena. And I would like to congratulate the faculty, the employees, the staff, the students, and everybody involved in this 50 years of active cooperation to build up this great institute. Thank you very much.